Hello once again and welcome to Clinic Annex with Dr. Abosede Adegbite. Thank you so much for your support. I appreciate it. And if you are new on this program, it is an online clinic where we discuss health issues and you would love it here. So welcome. Today let's talk about water therapy. From whom did you first hear the phrase water therapy? Is it from your friends or from a doctor? It's likely to be from your friends because water therapy is not really a medical term. Water therapy is a practice of the Japanese people, and they have rules, do's and don'ts about water therapy. But I've decided to do this today because of a pressing need. A friend of mine sent this document to me. I guess he did because he wanted validation. He wanted me to say, yes, it is good, do it, or it is not good, don't do it. So let us take a look at this document. The Japanese people say for water therapy, they advocate that you drink 2 to 3 cups of warm water as soon as you wake up. For another 45 minutes thereafter, you are not going to drink or eat anything. Whenever you want to eat, you eat for 15 minutes and you won't drink water for 2 hours. You can only drink water 2 hours after you have taken your meal. They also say that you cannot drink cold water. You should not drink cold water. There are claims of cold water causing cancer, causing heart attack, and causing your liver to have a lot of fat. The fat that you eat will be hardened or congealed because of cold water. And lastly, they claim that water therapy can cure all forms of diseases. For hypertension and diabetes, they say that it will cure those in 30 days. And for any form of cancer, it will cure any form of cancer in 9 months. Well, I don't know the source of this information. However, a lot of the claims here are not true. And it can be harmful to people. That's because somebody that has hypertension and diabetes or cancer, instead of them to go to a doctor and get attention and help, they'll be doing water therapy. It can get complicated while you are doing your water therapy. That's why you shouldn't wait. You should not focus on water therapy. Even if you want to do water therapy at all, go to a doctor first. You can be doing your water therapy by the side. So, I am not saying that it is wrong to take water. Doctors all over the world unanimously agree that drinking water is ideal and it has health benefits. But any ritual that you want to attach to it is your personal decision. There is no need for any rituals when it comes to drinking water. So, should we drink water hot or cold, warm or cold? Honestly, it is a personal preference. And it is also influenced by the place you live in the world and the climate of that place or the weather of the day. You can live in the temperate country, but that particular day is very hot. So you may want to drink cold water. If you live in the tropics, a very hot country, you might not be able to drink warm water on a sunny day. It won't be refreshing. So at best, you drink room temperature water. And it may not be practical in the winter when it is very cold and it is snowy to drink cold water. But it will be very comforting to drink warm water. So these are the things that influence your choice. Also, if you have some medical conditions, for example, if you have teeth sensitivity, you won't be able to drink cold water. And if you are a sickle cell disease patient, it is not ideal for you to drink cold water on a cold day. You might have a bad crisis. So these are what might influence your choice, but not because it causes cancer. Cold water causes cancer, or it causes heart attack, or it causes hardening of the fat inside us. In the face of digestive enzymes and bile and hydrochloric acid in the stomach, it is not possible for cold water to harden any fat that you take. So that claim is not true. So what are the health benefits of water and the risks that are associated? Well, quite a number of benefits. Number one, you are well hydrated, your skin is supple and beautiful, your skin toggle is good. You'll be able to digest your food well and eliminate waste easily. So you are not likely to have constipation. Some people use it for weight control. They drink water first and then eat later so that they don't have space for food. And that way they can control the amount of food that they eat. It also helps to regulate body temperature and maintain fluid balance. Blood flow will be good, and then you are not likely to have kidney stones, and you will reduce your risk of having urinary tract infection, bladder cancer, colon cancer, and there are other benefits. So it is actually good to drink 2 to 3 liters of water per day. On a sunny day, it can be more. On a cold day, it can be less, but the minimum you should take in any day is 2 liters. For those that drink bottled water, that is about 3 to 4 bottles per day. And for those that drink sachet water, that is 4 to 6 sachets in a day. So what are the tips for taking water? You want to start as soon as you wake up. And you want to go around with a bottle of water for accessibility. In your office, you can keep a pack of bottled water so that anytime you feel thirsty, even without feeling thirsty, you can drink. You should also monitor your urine. It should be pale yellow, very light yellow. If it is deep yellow, then you are not drinking enough. And you may want to infuse it with fruits, especially for children or any other person that doesn't like to drink water. It will enhance the taste and you'll be able to drink water better. So is there any risk associated with drinking water? Oh yes, if you drink water excessively or rapidly within a short period, it can cause water intoxication, not usually among healthy adults, but among those that have kidney, liver, or heart conditions. They can have water intoxication, meaning that the water quickly dilutes the blood and the salt level drops. We call it hyponatremia. When the salt level drops, the brain can swell, people can have vomiting, nausea, they can even convulse, they can go into coma and die. So for those that have these conditions, they should not drink water too much within a short period. So it is not ideal to take more than 1 liter of water in 1 hour. Thanks for watching. The next time you want to tell somebody about water therapy, be sure to give them accurate information and not mislead them, please. And if you're not sure of the source of an information or you have not verified whether it is true, please do not share it with anybody. Remember, good health is great wealth. We won't take it for granted. If you have questions or comments, put them in the comment section or on the WhatsApp number showing on your screen. I'd like to answer them. I'd also like to make videos out of some that can benefit other people. See you next week, God willing. Until then, please be safe. Bye for now.